Replacing myths with realities. I think the eating disorders field has suffered perhaps more than any under misconceptions about what cause eating disorders and how to treat them. One of my idols, Gloria Steinem, said the first problem for all of us, men and women, is not to learn, but to unlearn. So part of what I'm hoping to do is giving you some new ideas about how to help other people unlearn, because I view talks like this as sort of really being able to spread out like ripples. If we can all come together with some new thoughts tonight, then you can go out there and you can share those new thoughts with other people, and we can really change the way that people think about eating disorders. So here's another myth, and this one I just want to like kick straight out of the stadium. Families are to blame. The number of patients that I have had come to me and parents that I've had come to me and told me that their GP or their physician said that the reason their kid has an eating disorder is because of their parenting. I cannot count how many times that has happened. What it does is it makes people shy away from seeking treatment, and it's my job and all of us health professionals' job to educate physicians and other healthcare providers that this is a myth that is completely and entirely unsubstantiated. And if you look, well, let's take it one step further. And it's not just parents, but we got to add moms, because moms always seem to be the ones that take the brunt of the blame for any psychiatric illness. Mothers are not to blame for anorexia nervosa or any eating disorder. Let's look at the history of psychiatry, how we've done this to other disorders. First off, there is no prototypic eating disorder family. They come in all colors, all varieties, so many different types of families eating disorders develop in. We had this first, Bruno Bettelheim talked about the refrigerator mother and autism. For how many years did people think that autism was caused by a cold and distant mother? Now we are perfectly comfortable knowing that autism is a neurodevelopmental disorder. And if anything, parenting is the most important thing in helping these children live successful lives. Same thing, schizophrenia. Frieda Fromm-Reichmann, the schizophrenic mother. So what a horrible term. Again, saying that mothers somehow cause this horrible biologically based mental illness. As much as I love some of his writing, I think he was a great writer, I think Minuchin sort of started taking us down the path that somehow families were to blame for anorexia nervosa. He talked about the psychosomatic family. He wrote really interesting work about what happens when you bring the family together during a meal. But he was also looking at a very select population. He had a clinic in Philadelphia where mostly upper middle class people could come to. And frankly, by the time a family comes to me with a child who has anorexia nervosa, the anorexia has affected the family. It's not that the family caused the anorexia, it's that the anorexia disrupted the process of the family. And I think sometimes when we see people late in that process, all people see is that cross-section of a family in distress. And then they make false assumptions about that family being a causal factor. In contrast, families are often our best allies in treatment. And especially when we look at the treatment of children and adolescents with eating disorders, getting those families involved whenever possible and whenever appropriate is really important for long-term success.
Also, you know, we do pathologize parents in this field, and that still occurs. So when I round in pediatrics on our ward, and if we have a teenager that comes in and they come in renal failure and they have been up in the ER with their parents all night long, it's new onset renal failure, everyone's been worried, no one's been sleeping, the kid's been sick for about a month and the parents have been worried. There is some toddler running, we walk into the room for rounds and there's some toddler sibling running around like a demon, completely overtired. The parents are sniping at each other over the parking space that they didn't get, and no one walks out of that room and says, wow, my kidneys would fail too if I had parents like that. But with eating disorders, if I walk into the room and I see the exact same thing, the exact same situation, and the parents are equally exhausted and been watching their child starve, and they've been up all night in the ER waiting for a bed, that is often what someone says when they walk out of the door. We are often really picking very low-hanging fruit to find fault with the parental systems. And I would challenge everyone to really try to look for strengths. They're not hard to find if you look for them, but they're really critical, and you really don't get anywhere pointing out all the weaknesses.
So I thought about it a lot since then. You know, we were trying to get her to eat before, and we were not having any luck. In fact, what we were having was a lot of conflict and a lot of angst, you know, and a lot of extremely unpleasant, tense meals with a lot of yelling and screaming, which we really hadn't had in our family before. So people often say, so what's different with family-based treatment? How, you know, now you're going to take charge of her eating. Well, you weren't very successful before, so what works? And I think the key, there's a couple of things really, and one is, although no one ever said to me or my husband, this is your fault, we felt that very deeply. And I know people were thinking it. I know doctors in the hospital were, I know that doctor in the ICU was thinking it, even though he didn't say it. I know nurses were thinking it. And in the years since then, I have heard with my own ears comments, especially from medical people. You know, I've heard doctors leave the room of a patient with anorexia saying, yeah, I'd be anorexic too if I had a mother like that. You know, would you say that if the child had cancer? Would you say that if the child had pneumonia? I'd have pneumonia too with a mother like that. So, you know, so even though no one actually said the words to us, we felt judged and we felt guilty. And we wanted, in a way, for it to be our fault because then we could fix it. My daughter, for example, she was diagnosed as depressed. She wasn't diagnosed with an eating disorder originally. Well, actually, depression and anxiety are byproducts of malnutrition, you know. So you can't know that though until you're physically healthy. And we do know also that physical recovery has to come first before mental recovery.
Parents don't cause eating disorder. I think parents or families become organized around the problem. But if you look at the writings in the family therapy field, the leaders in the family therapy field, the view that families are the problem and therefore they need treatment, that the child is somehow only the symptom of what's going on in the family, really went out of the window 15 years ago, 20 years ago.
You have to know that nothing you're going to tell me is going to make me believe that you made your child have an eating disorder. What we know is that eating disorders start for a lot of different reasons, and there are no data to support at this point that parents cause their child to have.
I think traditionally, and not just tradition, I think today still, a lot of providers would not see the parents as part of the solution, but as part of the problem. And I think that's been a pervasive attitude among a large number of clinicians in our field.
People really around the world have said you need to separate the patient from the parents because the parents are this horrible influence. We have got to get that out of people's heads.
It's left them angry, it's left them full of blame. What it has not done is to help anyone.